So, very good evening, everyone. Hope you are doing well. In today's lecture, which is my lecture number 94 of my lecture series, we are going to look into the future of insulins. We are going to cover the next generation insulins, which will be having an overview of the once weekly insulins, the ultra fast acting insulins, the glucose responsive smart insulins, and we'll also look into the latest insulin delivering technologies. So, let's start right away. Two important exams are coming up for the endocrinology trainees all over the world. The European Society of Endocrinology board exam. This will be held on the 12th of December this year. And the specialty certificate exam will be held on the 12th of November this year. So do register for these exams and wish you all the best for these exams. So basically my lecture series, which is the Mastering Endocrine and Diabetes lecture series, so far comprises of 94 lectures. It's available via subscription, and for all my subscribers, they will gain access to my existing 94 lectures plus all my lectures which will be coming lifelong. So there are lectures covering the entire spectrum of endocrinology and diabetes, which will definitely help you pass the specialty certificate exam, the European board exams, plus help you all in all the endocrinology board exams across the world. There are lectures on thyroid, pituitary, adrenal, diabetes, calcium regulation. There are several high lectures which covers the previous exam recalls. There are pearls from the Oxford Handbook, exam lab question and answers with explanations, lectures on reproductive system, lab endocrinology, genetic syndromes, immune checkpoint inhibitor endocrinopathies, lipid and lipid metabolism, and the latest lectures on obesity and metabolism, where I have covered three important lectures covering the different spectrum of obesity and anti-obesity medications. So through this lecture series, basically, I have tried to cover the NICE guidelines, the Joint British Diabetic Society guidelines, the American Diabetic Association guidelines, the American Thyroid Association guidelines, as well as the European guidelines and um, helping endocrinology trainees across the world to help pass these exams, plus also very helpful for their day-to-day clinical practice as well. So let's start right away with our next generation insulins lecture. So first and foremost, we'll be looking into the once weekly insulins. So the once weekly insulin, the first name which comes here is the insulin Icodec, which is by Novo Nordisk. This status is currently approved as Aviquili in certain countries in 2024 itself. The dosing is once a week basal insulin. So it's currently studied and approved in type 2 diabetic patients only. There is definitely improved adherence because it's just once a week. It's a simplified regimen. The trial which has been studied, which showed the benefit, is onwards trial, which showed actually non-inferiority to the daily basal insulin regimen in terms of improving the HbA1c. So that's an important part which mentions that it was non-inferior to the daily uses of compared to the daily use of basal insulin in a type 2 diabetic patient. So this is a good overview of all the trials which have been linked to the insulin Icodec. So the onwards one trial was studied in insulin naive type 2 diabetic patients. Comparator was a once daily glargine U100, and in this, the Icodec was found to be superior for HbA1c reduction. Onwards 2 trial, these were insulin treated type 2 diabetic patients with basal insulin. The active comparator was degludec, and Icodec was found to be non-inferior for HbA1c reduction compared to degludec, and also it had a comparable safety. Onwards 3 trial was insulin naive patients. These were type 2 diabetic patients, but these were specifically Japanese population. Again, the active comparator was glargine U100, and Icodec was found to be non-inferior. Onwards 4 trial involved type 2 diabetic patients on basal bolus insulin. Here the active comparator was degludec plus bolus insulin, or basically a basal bolus regimen in which the basal insulin is degludec, and icodec again was non-inferior in this regards and maintained good glycemic control. Onwards 5 trial was insulin naive type 2 diabetic patients. These were real world diverse population. Again, your active comparator here was glargine U100, and icodec was found to be superior in this particular trial. Onward 6 trial was specifically on type 1 diabetic patients, and here the active comparator was degludec. In this particular trial, it was non-inferior in terms of HbA1c improvement, but there was higher incidence of hypoglycemia. So this was the drawback which was found on using insulin Icodec in type 1 diabetic patients in the Onward 6 trial. So if you were to look into the summary, so in terms of HbA1c reduction, we can say Icodec versus daily basal glargine is equal or superior. Time in range is comparable. Hypoglycemia, we found that there was increased risk or increased level one, increase in terms, especially in terms of type 1 diabetic patients. What about the weight gain? Again, slightly increase, maybe 0.5 to 1 kg difference. And if you were to look at the overall injection burden, that was significantly reduced because it's just once a week injection. So it was 1 per week compared to versus 7 per week, which we will be giving for insulin glargine. So this is a summary of the efficacy from the different trials for the icodec. So for the regulatory approvals, if the EMA has already approved it in May 2024 in type 2 diabetic patients. In Canada, it was approved in again 2024 in type 2 diabetic patients. The US FDA has approved also it in June 2024, but only in type 2 diabetic patients. Type 1 diabetes currently it was rejected due to the safety as regards the increased incidence of hypoglycemia reported with icodec. So this was the study in type 1 diabetes. As I've already mentioned, these were patients of type 1 diabetes on basal bolus insulin therapy, and they tried to look into once weekly insulin icodec versus once daily insulin degludec. In terms of the HbA1c reduction, it was non-inferior. There was a higher ratio or higher percentage of time below range. So basically, there was a more incidence of hypoglycemia. Due to the safety concerns, this limited the enthusiasm, and hence there is currently no regulatory approval for use of insulin icodec in type 1 diabetic patients due to hypoglycemia concerns. Let's move on to the next once weekly insulin, which is insulin efsitora alfa, which is basically again a once a week basal insulin. So basically, it's a long acting insulin fused to the Fc domain for prolonging its action. It's produced by Lilly Company. It has a comparatively HbA1c reduction with the weekly dosing. So phase 3 trials have been completed. Studies in type 1 diabetes are still planned or ongoing, but there is no such major phase 3 results in type 1 diabetes yet. So these are the different trials which has studied the insulin efsitora alpha. So Quint 1 was the insulin naive population studied over a duration of 52 weeks. If you look at the HbA1c reduction, it was more compared to the placebo. Also, the incidence of hypoglycemic events was significantly lesser compared to the placebo. Quint 2, these were insulin naive patients with or patients also on GLP-1 agonist, studied over a period of 52 weeks. Again, HbA1c reduction more versus the 1.26% for the placebo. Again, in terms of the hypoglycemic events, almost similar versus the placebo. In Quint 3 trial, the patients treated were on basal uh, insulin alone, and this was for a period of around 78 weeks. Again, the HbA1c reduction was 0.86% versus 0.75% for the placebo. The time in range benefit was better in this regards. It was increased by 1 to 2 hours per day. In the Quint 2 trial, it was found to be increased by around 45 minutes per day. So these we are talking about the sensor in terms of the time and range. So definitely a benefit for using the once weekly insulin, which is the insulin efsitora alpha. In terms of the Quint 4 study population, these were the patients on basal plus bolus insulin. Again, duration of over 26 weeks, almost similar HbA1c reduction versus a placebo, and again, similar incidence of hypoglycemia. The time in range benefit was not reported in this regard. So time in range benefit definitely reported for the Quint 2 and Quint 3 trials. So key takeaways from all these trials for insulin efsitora: consistently non-inferior to the daily basal insulins with minor advantages in glycemic control, comparable of fewer events in Quint 1 and Quint 2 for the hypoglycemia, mildly higher in complex regimens like Quint 4, as we can see here, which is because patients were on basal bolus regimen. There is definitely a reduced injection burden by approximately 85%, improves the time in range and tight glucose control. And currently, the status is they are filing for approval in type 2 diabetic patients, and it's expected by later half of 2025. Currently, type 1 diabetic patients, study in type 1 diabetic patients is not being pursued for insulin FC DORA. So overall regulatory status as of mid 2025, Icodec is approved is avically in type 2 diabetic patients. Type 1 diabetic patients, there is no approval. Same for efsitora alfa. And in the study, which was for Icodec with type 1 diabetic patients, they had found more incidence of hypoglycemia, thereby limiting the enthusiasm regarding this study and not getting the regulatory approval for this regards. Now, we'll be looking into the next section, which is the ultra fast acting insulins. And that's the end of my preview. For this particular full session of this lecture, which is lecture number 94, please subscribe to my lecture series. In the full session, I've talked about further on the ultra fast acting insulins. I've also talked about the smart insulins, and also I've looked into the latest insulin delivery technologies in the later half of this lecture. So all paid subscribers will be given lifetime access to this lecture, of course, and all my existing 94 lectures, plus all my upcoming new lectures for lifelong. So for subscription, please email me on nazirules@gmail.com or just WhatsApp me on 0097155 7434794. Thank you so much.